Okay, hi, welcome to From Bedside to Breakthroughs, How Nursing is Innovating Healthcare. My name is Sarah Giordano, and I am a holistic nurse, and I have worked in many different settings, including at the emergency department for over 15 years, where I was at the bedside as well as a nurse leader. And I've also worked quite a bit in entrepreneurship. I was a head of clinical operations for a digital health tech company, and I was the general manager for a yoga company that was my own company. And I also currently am working as program director at a wellness center in New York City, where I am head of the IV vitamin therapy program. And all of my entrepreneurship endeavors have been heavily based on evidence-based practice, as well as using the nursing process to guide my innovations and helping to drive healthcare forward. Last year, I even designed and implemented my first research project looking at the effectiveness of IV vitamin therapy. So everything that I share with you today is completely separate from the views of the Well New York, where I work in New York City. Our learning objectives for this program are going to include the ability to describe describe the evolving role of nurses and the core value of our profession, discuss innovation and how we can create innovative cultures in many different settings using nursing fundamentals, to distinguish the role of nursing in interdisciplinary collaboration, to identify the challenges and opportunities facing the nursing profession. We are going to define leadership styles and how they impact nursing leadership and how we can impact healthcare transformation. And I would really hope for you to conclude how you can make a difference in your nursing setting. So nursing innovation, this course highlights the transformative impact of nursing professionals on the healthcare landscape by examining innovative practices, emerging technologies, and interdisciplinary collaboration. This course aims to showcase the vital role nurses can play in shaping the future of healthcare. So innovation has long been part of nursing. When we talk about innovation, we like to define it as the development of any new idea, service, process, or solution, and putting that into making that into fruition. So nurses have been doing this for a really long time, over the past centuries. Just as a quick overview of our history, back in the 1600s, a lot of the caring was done in monasteries by monks and nuns, and a lot of the education was through apprenticeship and observation only. So during wartime, that really kind of kickstarted our profession, moving us forward, as there were such a demand for healers at that time. I do want to point out that there was a mix of men and women at that time during mostly the French and Indian War, as well as the Revolutionary War. In the mid-1800s, we all know Florence Nightingale. She was a real pioneer for our profession, and what she did during wartime was utilize sanitation and ventilation efforts to decrease death tolls, and it was actually something like 80% decrease in the Crimean War of the soldiers that she was caring for. So that was really quite impressive what she was doing, and she wrote a few books on her theories, and it was really fundamental for our profession. In the 1900s, we saw a big advancement during this century, especially in our education system, as well as our regulatory licensing policies. So the US obviously started having the licensing boards, which really helped define, who we are and what we are here to do. Still, some countries don't have quite the advancements that we do in our profession here in the US. But this also led the way for nursing theorists and researchers to develop our field even further, which we'll talk about a little bit later. In the 2000s, specifically like 2010 through 2016, holistic nursing was founded and defined, really. And it's really a way of going back to the fundamentals of nursing, looking at who we are, what we do, and how we do it in a very basic way. So this was also something I think that really helped move our profession forward and is continuing to help us innovate here. In 2020, we all know that there was a global pandemic, and nurses were at the forefront making constant innovations. In the ER, of course, every day was different, and we had a different policy coming out, a different way that we needed to start to treat and handle the mass of patients coming in. And we really did a fantastic job of being able to put into place some of these necessary items to help combat this pandemic. So why are we natural innovators? So a lot of the qualities within many of the nurses in our profession have critical thinking, scientific method. This is something that we are given from day one of how to look at something, look at the research, and decide whether or not that this is clinically sound. We are process driven. We have the nursing process that is fundamental to everything that we do, which again, we'll go over a little bit later, but this is really helpful in innovations that we have kind of a system to do this and this and this, and then we find a lot of success with that. And it's a really helpful process. We are creative in nature, especially in the ER. You kind of got to do what you can do with what you have in the moment. So we like to get creative, and we can do that in a very interesting and helpful way, which really helps us with innovation as well. Observing is one of our basic skills. We have to, assess and observe. Again, from day one, even just taking something like vital signs, we have to observe the patient. So this also helps with innovation, observing what do we see, what is getting developed, and then reassessing that. We are tenacious. We get through pretty much anything. So again, just getting through that pandemic together just shows how we really are. We go for it, and we get things done when they need to be done, and that's super important when it comes to innovating new technologies and new solutions. The next three that I highlight here are very innate to nurses: caring, compassion, and listeners. This is what nurses are. We are the most trusted profession in the field, and this is why, because we care. And again, the scientific method is really behind everything that we do. So that, again, makes us really good innovators, rather than just going for something without showing the soundness of where we're going, is going to set us apart. And innovation can really have an impact across a lot of different settings. So whether you're right at the bedside, you're still within the hospital, even broader within the healthcare system, going into entrepreneurship or business, looking at all the new technologies rising within the field, going into actual research and conducting the data, conducting the research that shows the data to these solutions, or even at the government level, making policy and making change. Nurses can really be in any setting. And we take those qualities with us to help us make impact. So I do want to highlight some of the nursing theorists. These are some of the founding philosophies that shape our profession. There's quite a few of them, but I'm just going to highlight a few here. Starting with Martha Rogers, who was in about the 1950s. She came up with a theory of science, the theory of science of unitary human beings. And this is really foundational. A lot of the other theorists build on Martha Rogers' work. And basically what she's saying is that we are more than the sum of our parts. So we are made up of not only our physical being and our health, our physical health, but also our mental, our spiritual, our emotional, looking at our exercise and nutrition, but also looking at our spiritual practices and our relationships and how our health is within them. Really, that's very fundamental to nursing. When we look at our patients, we're looking at the whole being, right? So that was Martha Rogers. Building on that was Elizabeth Barrett, and who had the knowing participation in change. And this was putting the power back into the patient's hands. So allowing the change to be facilitated from the patient knowing what is going on with themselves and having the power to make that change themselves. And we're just more of a support system within that. Next, we have Barbara Dossi, who is the founder of International Nurse Coaching Academy. She came up with integral nursing theory, which is built on Martha Rogers' unitary human being theory. And this is really taking into account not only the health of the patient, but also the health of the nurse, and keeping ourselves through self-assessment and self-care in a healthy state in order to care for the other beings is really foundational. So being able to fill up your own cup before giving your cup to someone else is super important for nursing. And we'll talk a little bit more about how some of that has been challenged recently. One of my favorites is Margaret Newman. She has a couple of theories, but one that really stands out to me is health and as expanding consciousness. And this is basically a theory saying that not only, again, building on Martha Rogers, not only are we a whole being, but so is all living things. And we are actually connected through consciousness, and being able to tap into that relationship between us and all living things is really where health lies. So very, very fascinating philosophy that she dives into. It's a little bit more metaphysical, but super interesting to read into. The theory of transpersonal caring by Jean Watson is also a really, really foundational theory that we want to look into. You can read, I believe her book is called 10 Caritas, and it looks at how do we care? So yes, we all know that nurses are caring and compassionate, but what is the how of that? And how do we care? And what are the actual items that make up caring? And again, super inspirational theory. So if you do want to look into that, I would suggest giving her a read. All right, so looking at the current trends in the nursing profession right now, quality and safety to me is always at the top. So first of all, we want to look at making sure that the care that we deliver is safe for the patients and it's safe for us. And are we giving the best practice, evidence-based practice care, quality care that we can? So this is a big trend in nursing. It has been for a long time. And I'm sure it's at the top of a lot of your lists as well. Reducing healthcare costs. So we know that the healthcare is super expensive, not only for hospital systems, but also for the patients themselves, and having to, pay for monthly medications and different treatments and stuff can be absolutely debilitating just financially. So we know that that's also a trend. The nursing shortage, we all hear about this constantly right now. It's such a struggle. We have a lot of nurses retiring. We have a lot of struggles within the profession right now, so it's hard to recruit. We are also seeing a shortage of nursing educators, making it difficult for nursing schools to graduate new nurses. So the nursing shortage is a constant trend, but right now it's quite forefront for us. One of the things that's kind of contributing to the nursing shortage is compassion fatigue and mental health. So again, the pandemic was really strenuous on a lot of us. Can take a lot out of you to, give everything that you've got every day. The job can become, more of a lifestyle for a lot of nurses. So this can really wear us down. A lot of my colleagues in the ER, a lot of us were in therapy throughout the pandemic. And, it's really important to support our mental health so that, again, we can, fill up our own cup before we give it to someone else, which is, very instinctive for nurses to care for someone else. Telemedicine. So the pandemic also kind of shoved us into a lot of telehealth, getting our patients to communicate virtually has kind of taken a turn, uptick. So I think that's a really good trend that's happening right now to kind of break down those borders of physical location. Travel nursing has had a few different responses to it. Of course, it's a really great option for nurses to be able to travel around, to be able to experience different areas, both rural and more city locations. Very interesting work. It's also put a little bit of a burden on nurses that are within the hospital. So travel nursing is coming in and taking some of those jobs. The pay is a lot higher for the travel nurses than the nurses that are stationed in the bedside in the hospital at that time. So this has been a difficult trend that we're trying to keep up with. Also, travel nursing is confined to the US. So again, we have those issues with licensing. You may have a one state license, you might have a couple states license, you may even have a compact state license where you can practice in many different states. But it's really difficult to go across borders to different countries internationally. The nursing standards are not quite the same, and the licensing can be a little challenging. Specialization is a big trend in nursing right now. We're seeing nurses kind of specialize into either critical care or oncology or hospice. They're getting more tunneled into these kind of silos, which I think has some benefits to that trend. Nurse practitioners has really taken an uptick in the last few years, and job growth will continue in this area, I believe, as primary care starts to transition away a little bit more from physicians into nursing. And I honestly couldn't be more excited about that. I think, the way that nurses look at humans as holistic beings and really take the time to sit and listen, I think this is really important for our profession. So there's going to be a lot of job growth in that area. And technologies. There's a lot of technologies emerging that are going to help with our profession, and we're going to talk about some more of those later. So how do nurses innovate? What do we have? What tools do we have? We have our nursing process. Fundamental, right? This is what we learned from day one, okay? So we have our assessment, diagnosis, planning, implementation, and evaluation. We all know these steps, but these can be applied to all different industries. When you assess, you're looking at the situation, you're doing the research, you're looking into what works, what's worked in the past, what might work in the future, what has already been developed in the area that I'm looking. When you research the situation, then you can really define the problem well. So if you just start to define without doing the research and getting into the clinical background of it, you haven't fully defined your problem. So assessment and then diagnosis, define that problem. Now you start your planning phase. You plan your approach. You include further research, constantly researching, constantly digging deeper, right? Then you implement. This is really a testing phase. So I always think of the first implementation as a test. You're just going with a little sample. You want to see if what's working and what's not working. And that shoots you right into your evaluation phase where you're going to evaluate the outcomes and analyze the data again. Take all of that information that you got, look at it, what worked, what didn't. The nursing process is a continual cycle. So you're constantly going around and around. And not only is it one by one, it has to do this and then do that. You can be simultaneously implementing and assessing at the same time. But these 5 areas are super, super important when you're going to innovate. And we know how to do all of these things very well. I want to give you an example of the IV vitamin therapy research that I've done in my current position. When I came into the position from the ER, I first said, okay, you're putting vitamins into someone intravenously. We don't have any lab work. It's just, whoever comes in off the street, mostly healthy adults. Yes, of course, we're doing an assessment. We're seeing if there's any contraindications, these types of things. But where's the data? Who's been doing this? And can you show me the research that shows the effectiveness? I started to dig around a little bit, first speaking with my providing physician, speaking with the pharmacist that I work with, asking around, looking up the research online, but I really didn't find much. And when I asked the physician and the pharmacist, they said, you're right, there's not a lot of research in this area. So as a nursing innovator, my first thought was, well, I have all these patients coming in. I can certainly conduct some research myself. So now I'm doing assessment. I'm defining the problem. There's not enough research on this area. I'm starting to plan. So I came up with a plan. I had a 3-part series of surveys that I was going to implement to all of my customers that came in for IV vitamin therapy. The first component was taking a survey on day 1 when they arrived, just before they were given the treatment. And the survey included 22 symptoms of dehydration and vitamin depletion, including things like fatigue, brain fog, anxiety, dark urine, dry skin, acne, lots, and anything really to do with dehydration and depletion, 22 of them. And then I had them rank them on a scale of 0 to 5 to tell me how often are you having these symptoms. And we did the survey right before they started, then the survey again, same survey, 1 day after the treatment, and then again 1 week after the treatment. And we gathered this data for 200 clients and analyzed the data, looked at the results. I had 87% positive response rate. It was a great first step. This data is in the process of publication for this year. However, there are some holes in this research. I didn't have a control study. It's really difficult to control nutrients, right? So nutrients are in all cells in all of our bodies. We get them from our food. We get them, from everywhere. We store them. We use them later. So it's a really difficult area to control. That being said, that it's not that it's impossible, but this type of a study can add to the data pool. Now, the next person who wants to create a study, maybe it will be me again, will have that kind of as a stepping stone. This is a place to start, right? So I used the nursing process. I assessed, I diagnosed, I planned, I implemented, and I evaluated. And I'm continuing to assess, seeing what's working, what's not, and going from there. Evidence-driven innovation. So, is the research of the innovation complete? So again, from that example, we saw that the research was not complete. But I started by my decision-making process of, am I going to be delivering quality, safe care, looking at the evidence? And then building on that decision-making process, I'm also going to have evidence-based practice. So that means things like making sure that the handling of the medication is done in a sterile way, the storing of the medication is done properly, the insertion techniques for the IVs are being done properly by all the nurses. So making sure that the practice that is in place is evidence-based. So a lot of that came from developing SOPs or policies and procedures for how all of these things were to be done within the system. So at the current program I'm at, there was no policies in place. I had to write all of them. But using the OSHA guidelines, DOH, Department of Health guidelines, the FDA guidelines, and the Department of Pharmacy, actually, the Board of Pharmacy actually helps as well to make sure that I was doing the best evidence-based practice and that all the nurses are educated in that those procedures. And then taking it a step further, evidence-based leadership. So I think this is really one of the main points of how nurses can innovate and support innovations. And this can be in all of those different settings that we spoke about. An example, again, looking at the program that I'm with now, one of our founders was really intent on offering B12 injections to the general public. And I wanted to be a participant at the table of this conversation. So the marketing team was also a participant in this conversation. Marketing team wanted to kind of sell all of the benefits that B12 can have as, instant fixes from just coming and getting a B12 shot. And as a nurse, I decided I had to stop, look at the research, what's true, what's not true, what's a fabrication, what's exaggeration, what does the evidence actually say? So I pulled a full report of market research, and absolutely, B12 works at our cellular level. There's a lot of really good benefits from B12 in the body. However, a lot of us have plenty of B12 that's already being used and absorbed properly. There are a lot of benefits for injections for people who are not absorbing B12 completely. So if you have absorption problems, or if you're over the age of 50, or if you have dietary restrictions such as vegan or vegetarian, then your B12 might be too low. But if you're not testing it before getting the injections, it's not really the best practice to market this to the general public as a one size fits all. So through using the evidence to back up my decisions and suggestions, and also collaborating with, again, the pharmacist and the providing physician, and then again the marketing team and the rest of the branding team and so forth, we were able to come up with some really high quality evidence-based marketing messages that we were able to give to the public. So that was just a really great example of how evidence-based leadership from nursing can come and support these new innovations in healthcare. So technology innovations in healthcare. There is some fast growing things coming from health tech today. And nurses really can be at the forefront of a lot of these innovations. Things like precision medicine, where some of the diagnostic solutions are coming from AI-powered tools and really focusing in on very specific diagnoses. Biomarkers are also helping to support this. Things like genetic testing. There's so many biomarkers that we can look at. For example, if you're looking at cholesterol, typically you go into your physician or your cardiologist and they'll pull like maybe 4 biomarkers for your cholesterol, when really there's like 14 or 15 different biomarkers we can take to look a little bit deeper into your cholesterol and where it's going. And then matching that with your genetics testing. So these are some really exciting innovations that are happening and coming onto the market really quickly that could be supported by the clinical aspects and ideas of nursing. Wearables. So now, not only do we have data points that have gaps of like 6 months or a year when you go into your annual physical and things like that, you'll get your labs drawn and, oh, this is that and this is that. Wearables take out those gaps. Now you can see data that's continuous. What are your sleep cycles? What is your temperature? What are your heart rate variabilities? These things can be really, really exciting, and nurses are greatly positioned to be able to look at that data and decipher, what are the implications of that. Again, looking at that, not only just data, but the person as a whole, and being able to put those two together is specifically nursing. And that's something that we can really help bring these technologies out in a very sophisticated way. ChatGPT is a very fun, exciting new development in generative AI, where you can input some data and ChatGPT will give you a whole bunch of documentation. So on the physician side, a lot of physicians are using ChatGPT for, say, insurance documentation so that they can submit to insurances the proper documentation without taking too much time to write it all out themselves. This can be really helpful in nursing as well. Some of us may have experienced having to spend a lot of time on our EMR system and putting in data and documenting, and less time at the patient bedside. But ChatGPT could be a really great solution to help us get back in front of our patients. And nursing can help this growth. Nursing can support all of these technologies in the way that I'm saying, bringing that human aspect, bringing that critical thinking, bringing that listening and humanity. Real world case. So I worked for a little while for a health tech company in Dubai called Virtue Digital Medicine. And I was one of 3 people of a team. There was the founder, who was a hospital administrator from Johns Hopkins, and there was a chief financial officer, a finance guy, and then there was me. And my job was clinical operations. So a lot of what I did was, of course, helping build the business plan as well, but mostly I focused on researching the health systems in Middle East and Northern Africa, looking at how they were set up and what were the gaps. So one of the biggest gaps was access to healthcare. So yes, maybe in some of the cities, there were some hospitals, some being bigger than others, but when you got out into the rural areas, especially in Northern Africa, there was little to no access to care. So one of the first projects that we did was setting up an education project for teleradiology between Johns Hopkins University and the Ministry of Health in Ethiopia, where we trained 12 radiologists on how to read and set up teleradiology systems. So then they could receive images from rural parts of the country and be able to give diagnoses and things like that. So where healthcare was not able to access these patients in the past, then these physicians were able to reach out to them. So that was a really exciting development. Okay, so one of the assessment questions I'd like to keep you on your toes here is, what is the first step in developing a new innovation? Is it diagnosis, assessment, planning, or evaluation? And our answer is, of course, assessment. Before we're able to define our problem, before we're able to get started on a plan, or before we're able to evaluate any results, we have to first take into account what is going on. What are the gaps? Like I was researching in the healthcare systems, I had to find out what are the gaps by looking into the data, looking into the research, what's been done, what hasn't worked before, what's working, what will be some of our competitors. So starting to look at those questions first is always the first step. Okay, looking at interdisciplinary collaboration, communication across various stakeholders and industries is key, and nurses are very well positioned for this. We have some very fantastic communication skills that translate into all different industries. One is active listening, being able to make eye contact, listen, be able to repeat back, being able to really connect with your patient. Is translatable for not only patients, but board members and marketing teams or branding teams or sales teams. It's very important, and not a lot of people have that. Nurses have that very innately. And another part of active listening is listening with heart. Barbara Dossi talks a lot about this in her integral nursing theory. And this is really being able to connect at a human level, being able to listen to another person's deepest thoughts and ideas and concerns. Again, very specifically nursing skills that translate very well across all different industries. Motivational inquiry is our way of assessing. When we start to ask about how are you feeling, and then we start continuing, and how does that make you feel, and then how does that translate into your relationships, and how. So it's really being able to spark that inspiration in our patients or in our other team members, and being able to kind of get them to participate more through active questioning. These are some of the communication skills that we have as nurses that are going to translate into bigger settings. Collaboration. So another very fundamental idea in nursing is patient advocacy, putting the patient first and always going back to that. When you get to the more hospital level or healthcare system level, some of that starts to get lost when you listen to hospital administrators. Yes, there is an idea of patient advocacy, but the nurses are really the ones who are there, the patient bedside, fighting for them. And that is a very good collaboration tool. When you bring that into entrepreneurship, that going to bat for your client, going to bat for your team members, it's a very, very good quality in collaboration. Non-judgment, so holding everyone as equal, not looking taking away our biases, or at least evaluating our biases and knowing where they are and how they're affecting our decisions, and being able to take them away as once we know that they're there. So this is also another very nursing feature, is to be able to treat everyone as equal. And that, again, it holds a lot of power when you get into a bigger collaboration. And then evidence-based leadership. So always looking back at the research, going back to, is this the best practice? Some of the current challenges in the healthcare industry, I'm going to look at two different areas today, including technology and healthcare transformation. One of the big ones, which I mentioned a little bit earlier, is the EMR systems have kind of taken over our documentation, right? So we're spending a lot less time in front of the patient's face and instead looking at a computer screen. And I think this can be a really big challenge for us. However, also looking at it from a data analyst perspective, having really good detailed data input is super important. So the computer advancements are positive, but the way that it's actually translating into less time with the patient is not necessarily a great trend for us. So something like a ChatGPT solution could help us to get away from the computer and back in front of the patient where I believe we belong. And I think that's kind of across the board, not just at the bedside, but also in entrepreneurship as well. You're spending a lot of time in front of the computer. How can you be more human to human interaction? Even if it's telehealth, that's fine too. Privacy and data. As we have all this new data that's going in, all of this information that's going in, being stored, privacy becomes more of a challenge. How can we advocate for our patients and make sure that privacy is maintained? So HIPAA compliance is always at the forefront of what we're thinking about. But that can be a real challenge, especially when you're in these industries that are not built, and the founders are not from healthcare. The importance of HIPAA is not necessarily as forefront for them, but nurses can come in and say, this is really important. We've got to protect our patient data. AI assisted decision making. So this can be also again a really great innovation, but at the same time can be a challenge. We need to continue to bring humanity into the equation, make sure we're looking over all of the data and analyzing it from a human perspective, bringing that caring, compassionate component to the table. Healthcare transformation. So the challenge, especially in the US, is the cost. The cost of these solutions is astronomical, and this has been a really big challenge. How do we reduce costs for healthcare systems so that they can support nurses better? And how can we reduce costs for patients so that they can get the care that they need? Staffing issues are across the board a big issue. Having, compassion fatigue and mental health issues is a real rising concern. All the nurses that are currently in my IV program came from emergency room or similar situations, and a few of them were ready to leave healthcare completely, and it's because it can be really, really draining. when you give, and you're not getting back. So one of the big parts of my program is to support the nurses and help them with the self-development and self-assessment and self-care, so that they can build back up their passion for nursing. Regulatory policies across borders. So this is, again, a big thing for me. When I moved to Dubai, when I go abroad quite often, the regulatory policies in other countries are not the same standards, and there's a lot of different hoops to jump through. There's a lot of difficulty crossing borders as a nurse, and I think this is a real challenge for us, but not something that's insurmountable. So hopefully in the coming decades, we will see a lot of more international nursing development. And chronic disease is one of the biggest, changes in healthcare over the past, few decades, maybe the last century, moving from acute disease over to chronic disease, and the burdens that has on cost of healthcare and so forth. This is a big challenge for us. Leadership. Nursing in leadership is very inspiring. I think that we are setting trends, whether it be through holistic nursing or jumping from nursing into entrepreneurship. We have these skills that we've been talking about that are so supportive of teams and of development, that I really see nurses as leaders being a very big development that's coming into our profession. And I think that's really exciting. When we talk about leadership styles, there are, of course, specific categories that you can define for leadership styles. However, here I really like to impress upon you that self-assessment and self-development are really the keys to developing your own leadership style. So looking at, what do you value most, and what is most important to you? What drives you to be a nurse? This is going to create your leadership style. And I think that combining those passions with evidence-based decision-making and bringing evidence to the boardroom and becoming a leader using the foundation of evidence is really what makes nurses leaders. And then again, I really want to reiterate the importance of self-care, especially when we become into these leadership roles. I know as a business owner and as working in very demanding entrepreneurship roles, I have been guilty of being very preoccupied with the demands of the business, always thinking, are my nurses okay? Are my patients, okay? And from the time I wake up until the time I go to bed, I'm just thinking, is everyone taken care of? But inserting self-care throughout your day and throughout your process of innovation is only going to make those innovations and leadership styles more strong. Even if it's something simple like doing affirmations or meditations, short meditations, yoga practice, whatever it is that really helps you to refill your cup is going to make you a stronger leader. When you come from a place that is more filled or more grounded, I would say, then this is going to really come through in your leadership style. You'll be more calm and ready to listen and connected. So I really do want to point out that that's one of the main things that's going to support your leadership. So again, an assessment question. How can you innovate? Can you initiate policy change in the hospital? Can you develop health tech solutions? Can you research the effect of the mind-body connection? Can you improve access to care for underserved communities? You can pick many of these. In fact, I would say you can do any of these and many more. You can see that with the basic skills that you got in nursing school, you are prepared to take on any of these innovations. So the key takeaways from this course include that the nursing profession, as we saw, is historically adaptable to current trends. We saw it from wartime to Florence Nightingale to the innovations of education and professional licensing, all the way through the pandemic and how we really helped push the profession forward through such a time of need. The nursing process provides a basic plan for innovation supported by clinically sound evidence-based practice. So I think you've heard me say quite a few times that we are grounded in evidence-based practice. It's so important to do the research and look at the data and see what's working, what's not working, and what gaps need to be filled. Communication skills such as active listening, listening with heart, and motivational inquiry prepare nurses to be invaluable in interdisciplinary collaboration. Our innate skills, our training and experience with patients has prepared us to collaborate with bigger teams that are making big decisions about where healthcare is going. Healthcare costs, nursing shortages, compassion fatigue, and new technologies are some of the challenges facing our profession. Nursing innovation is well positioned to rise to these challenges. We have the tools to start to look at these problems and find solutions. Compassion, active listening, advocacy, and non-judgment are nursing qualities that support distinguished leaders. Each of us are well prepared to lead our profession to whatever direction is right for you and within your setting. You can make a difference. And that's really what I wanted you to get from this course. I want to inspire you to be able to make an innovation either within your setting or within the setting that is right for you. If we remember about the leadership styles, think about what is your values, what are the most important things to you, and using that passion to drive your innovative solutions is really what's going to help us drive the profession and healthcare as a whole forward. So in conclusion, nurses are well prepared for innovation. Our education and experiences prime us for developing solutions that can change healthcare. We are compassionate, scientific, calculated, creative. We are team players who deeply listen and empathize with others, and that makes us leaders. These skills translate across industries. As many nurses have migrated away from traditional hospital setting over the past few years, including myself, other industries are discovering our value, and it's invaluable. Using the nursing process and evidence-based practice to design cultures of scientifically sound innovation, we are ready to co-create the future of healthcare. I want to thank you for joining me in this presentation, and I hope that you are inspired to make some innovations in healthcare.